What is a stroke?
Well, stroke is a very common and devastating condition. It's the #1 leading cause of permanent disability in adults in the United States and worldwide. It is caused by either disruption of the blood flow to the brain by a blood clot that blocks the brain vessel, or by leaky vessel that produces bleeding to the brain. Unfortunately, we live in southeastern United States, which is also known as stroke belt of the United States. So everyone who is born here is twice likely to experience stroke in their lifetime compared to the same ethnic, genetic make born anywhere else in the United States.
What are the types of strokes?
It's called ischemic or hemorrhagic. These are the terms. So ischemic stroke is the one where blood clot lodges in the brain vessel kind of in the wrong time and the wrong place and precludes blood flow to the brain. Or bleeding to the brain occurs, and that would be hemorrhagic stroke. And this type of stroke is usually caused by high blood pressure and the wear and tear of blood vessels, and then they break off and leak blood flow.
What is a TIA stroke?
TIA is a transient ischemic attack, or some people call it a mini stroke. I'd like to call it a warning that a bigger stroke is coming. And TIA is a transient disruption of blood flow. It is almost always due to blood clot passing through the blood vessels or some blood flow changes that causes malfunction of brain tissue. But the good news is that it is transient, and the true TIAs do not leave any damage to the brain.
What are the symptoms?
What people need to know is FAST. Abbreviation is FAST. Face, arm, speech, time. So droopiness of the face, weakness of one side of the body, speech disturbances when the person cannot get the words out right, the person slurs words or finds the wrong words to express themselves, and then time. Time is of the essence. So the first 60 minutes from these symptom onset, whether it is transient or not, the first 60 minutes will largely determine how the person spends the rest of their lives. So you don't have much time. Within 60 minutes, you need to call 911 or call 911 for somebody who is having a stroke in front of you, and get to the hospital that is treating strokes.
How do you identify the symptoms?
Unlike heart attack, when there is a chest pain, with stroke, there is almost always no pain. Only minority of stroke patients actually call 911 themselves. It is up to relatives, coworkers, bystanders, caregivers to immediately recognize those symptoms.
Who is at risk?
A combination of high blood pressure, overweight, lack of exercise, poor dietary habits, and predisposition to these events, because those things tend to run in the family. So, and these are just very few risk factors. I'm not even talking about smoking and some other obvious things.
What treatment is available?
The only medical treatment that's capable of reversing this disability is called a tissue plasminogen activator, TPA. Simple way to remember, it's clot buster. So if someone has a stroke, you need to ask, bring me to the center that gives clot busting medicine. In Tennessee, we're hoping to have the system statewide geared up like trauma. So you don't bring trauma to the nearest walk-in emergency room, you bring it to the trauma center. So equally so, we would like to have certified stroke centers and the whole state mapped out so the EMS know exactly where to bring the patient.
For more information about strokes, go to the website of the Stroke Association.